Namaskaram to all. Sorry for 1 minute delay. We are starting. Chaturmukha samarambham Vakbhadacharya madhyamam Asmadacharya paryandam Vande Guru Paramparam Ragadirogan satatanushaktan Asheshakaya prasrutan Asheshan Avsukyamoha aradidan jakhana Yo purva vaidyaya Namostu tasmai. So, namaskaram to all. We were discussing something about our Upadrava Vyadhis, and we saw some of the details, some important points, why the Upadrava should be properly identified and taken care of. Generally, the rule is Tesham Pradhana Prashame Prashamaha Ashamyadastadha Ashamyadastada Paschachigilsedu Turnam va balavandam upadravam Vyadhiklishta sharirasya Pidagaradharohi saha. We saw that. And in our last session itself, there were some enquiries posted in the chat group about what are the possibilities of something else like Udarkam. Some of those points were there in the inquiries posted. We will definitely come to it because this is a vast area and important area. And interestingly, we saw the description of Upadrava Vyadhis in the Visarpa Chigitsidam in Charagaj. And we saw Upadravastu Ghalu Roga Uttara Kalajaha Roga Ashrayaha Roga Eva Sthulaha Anuhuva, and defined it as Rogadu Paschajayade iti Upadrava Sapnaha. So from the statement Roga Eva, we assumed that it should be a Roga. It should be a Roga which is identifiable from the Pradhana Vyadhi, which is identifiable separately from the Pradhana Vyadhi, and it should not be a Vyadhyavastha of later onset. That happens. And because the explanation given or the point we discussed was that this Vyadhyavastha is Avashyam Bhavi in a Vikara. It is an Avashyam Bhavi. It is a part of the Samprapti, so it will happen. Whereas Upadrava need not be so. It is not indispensable, and if it is treated properly by all means, in the proper way, in the proper time, using proper tools, then there is no chance of Upadrava. So that is an important thing. So Vyadhyavastha should not be misinterpreted as an Upadrava. But sometimes a Roga and a Balavan Upadrava can be there. For a Roga, the Upadrava may be very strong. The one option we saw, Turnam va Balavandam Upadravam Vyadhi Klishta Sharirasya Pidagaratharohi Saha. So that possibility we have seen. So in such cases, sometimes the time gap between the manifestation of the Pradhana Vyadhi and Upadrava may be minimal. We will not even identify such close manifestation can happen. Then we will not be able, we will be confused. The treating Vaidya will have a lot of confusions that way, because which is to be attended first, or which is to be postponed. So such things can happen. One classical example could be the case of Arshas and Udavarta. This is a classical example because this happens very frequently, and it is not a matter of just a textual reference, but it is a daily clinical experience. Arshas and Udavartam. Udavartam can happen, of course, it can happen as an independent vikara, but it can appear as an Upadrava of Arshas. And in that case, sometimes there are situations where these two vikaras appear almost simultaneously, at least in the sense of the person who is suffering it. He may not be identifying sometimes that he is having Arshas, but he will be having lot of troubles, and which will be primarily representing the Udavarta. That happens. This is happening when the Nidana bhavas or the factors are appropriately strong or strong enough to initiate these mechanisms. And obviously, Arshas may manifest without Udavartam as well. But as I told, the other option is also there. Vada abhibhuda koshthanam tair vina visajayate. So, for the manifestation of Udavarta, Arshas is not mandatory. But we are considering a condition where Udavarta is appearing as an Upadrava of Arshas. Durnamnam iti Udavartaha paramoyam Upadravaha. Durnamnam ityudavartaha paramoyam Upadravaha. This is always a potential Upadrava. Always a potential Upadrava and Paramaha Upadravaha. This can be considered as the most significant. Paramaha. So, this Udavartam can at times become more distressful, causing more suffering to the individual. So, this point is always taken into consideration in the treatment of Arshas. Respecting the Upadrava, even if it is not present, respecting a possibility of an Upadrava, that is how the entire treatment protocol of Arshas is designed. What is that? You will find Bhitva vibandhan anulomanaya yan marudasya agnibalaya yacha. So, important factors. What are that? Bhitva vibandhan. Vibandhan bhitva anulomanaya yan marudasya. Yad marudasya anulomanaya agnibalaya yadcha. Agnibalaya yadcha. So, three factors which will be properly and promptly respecting the Udavarta, parallel to the Pradhana Vyadhi, that is Arshas, parallel to the care given to Arshas. So, Bhitva vibandhan anulomanaya yan marudasya agnibalaya yacha Tadannabana arshasena sevyam. Arshasena tad annabana sevyam. Vivarjyam viparidam asmadu. Asmadu viparidam vivarjyam. So this example actually highlights how the pradhana vyadhi and upadrava can coexist. We're coming to that aspect when they are coexisting. And all throughout this possibility of coexistence, when it is present, considering it as present, when it is not present, considering that it may be present at any time, the entire course of treatment is designed. So these two lines is a classical example. Bhiktva vibandhan anulomanaya yanmarudasya agnibalaya yacha tad annapana arishasena sevyam vivarjyam viparidam asmad. Many other aspects. It is a beautiful sloka, one of the most beautiful sloka in Ashtanga Hridaya. But we are not going to that aspects. When that situation comes, we will come to that the beauty and the hidden meanings and all those things in this sloka. But now, just for the sake of our present context, this can be considered as a very good example. And here, in this example, what is happening? Arshas causes udavartam, isn't it? Arshas is causing udavartam. And udavartam initiates and invites a series of different sampraptis and rogas. Udavartam, that invites many other friends and initiates, help in initiating their sampraptis. Like that spectrum is so amazing. When the udavartam is manifesting in its full spectrum, the entire body from the head to the tip of the toe is shaken. Literally. And many times the interesting thing is that the patient will be prioritizing the symptoms. And if he is over-informed, what happens is that he will be selecting a specialty consultant based on the present priority. So sometimes he may be ending up in the doors of a ENT specialist, sometimes with an ophthalmologist, sometimes with a cardiologist, sometimes with an endocrinologist, sometimes again with a rheumatologist. That happens because Udavarta Samprapti invites and initiates a series of other Sampraptis, like sometimes Jwaram, sometimes Shwasam, sometimes Badhiryam, sometimes Timiram, sometimes even the psychiatric disorders, Manovikaram. And interestingly, all those things may be running together in the individual. So that is why the person is forced to prioritize the specialty or subspecialty or super specialty and work accordingly. That happens. Regarding this possibility, Acharya Charaka makes certain beautiful observations, which we should not miss in our clinical training. That is in the 8th chapter of the Nidanasthanam of Charaka Samhita. We will see how he is explaining that concept. Nidanarthakaro rogo rogasyapyupajayade. Nidanarthakaro rogo rogasyapyupajayade. Rogaha, sometimes a roga, rogasya nidanarthakaraha api upajayate. Sometimes a roga rogasya anya rogasya nidanarthakaraha api upajayate. Api you can put in a different place also. Rogaha api rogasya nidanarthakaraha bhavati. So that is also a possibility that should be taken care of. So this is all about, as we mentioned in our last class or session, this is all about how the young clinician is trained, looking into all these possibilities. Kaschidhi, sorry, nidanarthakaraha rogaha rogasyapyubalabhyade. Rogasyapyubalabhyade. Then tadyadha jvara sandabad rekta pitta mudiryade. Tadyadha jvara sandabad rekta pitta mudiryate. Then rekta pitta jvaraha. Sometimes jvara sandabad rekta pitta mudiryate. The santabam of the jvara can be a triggering factor. Udiryade can trigger rekta pitta. Then sometimes rekta pitta jvaraha. Rekta pitta can cause the udiranam of jvara. Tabhyam shoshachapyubajayate. Tabhyam, by these two, jvara and rekta pitta, shoshaha abhi ubajayate. Shoshaha cha abhi ubajayate. Then plihabhivruddhya jadharam. Plihabhivruddhya jadharam. Jadharad shodha evacha. Plihabhivruddhya jadharam. Jadharad shodha evacha. That is also a possibility. And it goes on. Many other things are explained. Many things are there, like arshobhyo jadharam dukkham gulmaschapyubajayade. Pradishyayad bhaved kasaha kasad sanjayade kshayaha. Kshayo rogasya hedutve shoshasyaapyubalabhyade. So that goes on. It can happen like that. Then what is the point that Acharya is trying to communicate? That is the interesting part. In the next shloka, he concludes, or he makes a statement. What is that? Te purvam kevala rogaha paschad hetvarthakarinaha. Te purvam kevala rogaha paschad hetvarthakarinaha. So be very careful. Ubhayarthakara drishtas tadhaiva igarthakarinaha. Ubhayarthakara drishtaha tadha eva egarthakarinaha. What is the meaning of all these things? We will look into it. Te purvam kevala rogaha. In the beginning, purvam, they are kevalaha rogaha. Diseases only, or just diseases. Paschad, later or subsequently, hetvarthakarinaha. Hetvarthakarinaha. The usage is very important in the proper understanding of the meaning. Hetvarthakarinaha means something which acts as delivering the artha, serving the purpose of artha or prayojana, or that object, or that meaning of, or the purpose of hedu. Something which is serving the purpose of hetu, hetvartha karinaha. So initially they may be presenting themselves as kevala rogaha, just diseases. Subsequently, they may act as hetvartha karinaha. And considering these possibilities, the next line comes ubhayarthakara drishtaha. They can be seen as serving the duty of both ubhayarthakari, serving the artha of both ubhayartham. That is the duty of a vyadhi and the duty of a hetvarthakari. Duty of a vyadhi and the duty of a hetvarthakari. What is that? That is how it is becoming ubhayarthakarina. Ubhayarthakaraha. The duty of a vyadhi means to manifest as it is and to cause the characteristic sufferings. That is the first artham. In Ubhayartham, first artham is to manifest as it is with its own identity and cause the corresponding characteristic suffering. Then Ubhayarthakari next is hetvarthakaram. What is hetvarthakaram? The duty of a hetvarthakara roga is to facilitate the initiation of another samprapti. Very important. Facilitating the initiation of another samprapti, allowing the nidanas to operate further widely. That is a very careful statement. Otherwise, this will be a misguiding statement. So I repeat, as a hetvarthakari, it initiates the, it facilitates the initiation of a samprapti. It is a facilitator. And what does it do? Allows the nidanas to operate widely further. That is ubhayarthakaraha drishtaha. And this need not happen always. That is why we have another bit of statement. What is that? Tadhaiva egarthakarinaha. Tadha eva egarthakarinaha. Sometimes they just behave egarthakari, not ubhayarthakari. What is egarthakari? That is serving the purpose of vyadhi alone. That is a standard vyadhi. Or sometimes serving the purpose of hetvarthakari alone. How is that possible? In that case, the vyadhi means the pradhana vyadhi or the pradhama vyadhi, it runs its course. And at one juncture, even if all its characteristics, presentations and sufferings are there, one point it starts acting as the hetvarthakari and succeeds in the manifestation of a new vyadhi, then it recedes. It cannot exist as it is anymore. So it recedes. So only one artham is served at one point. It runs a course of vyadhi alone, and at the point when it initiates another samprapti, it recedes, withdraw itself from the stage. So practically one thing will be operating at a time, only either the pradhama vyadhi, then it recedes, and then the second comes. To make this idea clearer, Acharya is making another statement. What is that? Kaschidhi rogo rogasya hedurbhutva prashamyati. Kaschidhi rogaha rogasya hedurbhutva prashamyati. Then na prashamyati cha api anye. Anye rogaha, anyaha rogaha or anye rogaha na prashamyandi. Instead, it continues to exist. And hetvartham kurute picha. Hetvartham kurute picha. So, kaschidhi rogaha rogasya hedurbhutva prashamyadi na prashamyadi chapi anye hetvartham kurute picha. So, these two possibilities. Sometimes it is egarthakari, sometimes ubhayarthakari. This can happen. So, as we saw in the case of our Arshas and Udavartam, there we find Ubhayarthakaram. Arshas is there, and later Udavarta happens. So at that point, Udavarta is an Upadrava. That Hetvartham, which was served in the manifestation of the Udavartam. So Udavartam is there, and Udavartam is an Upadrava. So that is one question that is coming up. What is the difference? In the chat box, I found difference between Hetvarthakara and Upadrava. Hetvarthakara is the Pradhana Vyadhi. Upadrava is a subsequent one. So the Hetvarthakara and the Upadrava exist together. When they are existing together, the Pradhama Vyadhi, that means the Hetvarthakara Vyadhi, is becoming Ubhayarthakara. If it recedes, then it is Egarthakara. So it is Upadrava only. The second one is Upadrava, no doubt. And it runs with a prolonged course and with multiple initiations of Sampraptis. That is what we saw in Udavarta. That is why Udavarta is becoming a chief concern in many current clinical practice or practice situations. And another point here is one doubt. Actually, Chakrabani is putting forth that doubt as a Purva Paksha and tries to explain it. What is that point? Here we find Rogasya Hedur Bhutva Prashamyadi. That is how we saw the explanation here. So here the Roga is the Karana for another Roga. Roga is the Karana for another Roga. So does it mean that there is a fourth Karana for a Roga apart from that Kala, Artha and Karma? So Kala, Artha, Karma, Hina Mithyadi Yoga is the Ega Karanam, what we have seen earlier. So now, do you mean that there is a fourth cause? That is, a Vikara can be the Nidana for another Vikara. So Chakrapani takes this point to discussion, which is an important point because then it will be a Pradijna Langhanam, isn't it? That should not happen in a text. Then he is explaining, no, it is not like that. And that is why the author was very particular about certain statements like Nidanartha Karaha. Not Nidana, but Nidanartha Karaha. That is how it is told. Nidanartha Karo Rogo Rogasyapyubhajayate Rupalabhyade. It is not Nidana, but Nidanartha Kara. What does it mean, or what is the difference? In the Nidana, Kalam, Artham, Karmam, all these things comes. Nidanartha Kara means something which is doing the Artha of a Nidana. That itself is not the Nidana. So, the Pradhana Vyadhi has got its Nidana and its Samprapti, and there will be a Janaka Dosha, there will be Anubandha Dosha, they start operating. And when the Nidanas continue to exist and they get all the support from the Kalam, Artham and Karma in that given situation. They gain more strength, and by some way or the other, some sort of a defect happens sometimes in the treatment, sometimes in some other aspect, sometimes in the lack of pada sambat or whatever it is. Then it is the same Nidana of the Pradhana Vyadhi which is taking the Samprapti further forward, causing the manifestation of the Ubadravas. Causing the man. So here the Vyadhi is not the Nidana, but it is a Nidanarthakara factor. The Nidanas are not violating the basic rule Kalartha Karmanam Yogo Hina Mithyadi Matrakaha. So this is also important, because otherwise we have seen that Tesham Pradhana Prasame Prasamaha. So when the that Upadrava is making troubles, our focus may be getting limited to the symptom masking of the Pradhana Vyadhi, then the Upadrava will subside. That is what we think. It should not happen. The basic line of Ayurvedic approach should be taken care of, and that is about Sankshepata Kriya Yogo Nidana Parivarjanam or Vinabi Bheshajer Vyadhipathya Nivartade or Jayande Hedu Vaishamya Vishama Deha Dhadavaha. So these are the very fundamentals which should not be violated in our beginning itself, in the very beginning of the clinical training itself. So that is very important. So there is one more point. Does it mean Prabhava of a Vyadhi leading to other disease, not the Nidana? Yes, that is one point. But in the next line, Chataka uses one word called Vyadhi Sangaraha. These are all Vyadhi Sangaras practically. And interestingly, you see the Vyadhi Sangaram, for the reason for Vyadhi Sangaram, Evam Krichradama Nrinam Drishyande Vyadhi Sangaraha Prayoga Parishuddhatvad. So who is blamed? Vaidya is blamed for the manifestation of all these things. Vaidya is primarily blamed. Prayoga Parishuddhatvad Tadhacha Anyonya Sambhavad. Certain diseases are having the habit of Anyonya Sambhavat. So that habit may be considered as a prabhava. Why it is so? It is the swabhava. And such a swabhava is known as prabhava. So certain vikaras are having that characteristic prabhava, but the first place who is put as the culprit, prayoga parishuddhatvad. It is because of the incapability of the treating Vaidya. Prayoga parishuddhatvad. That means because of ashuddha chikitsa. Prayoga parishuddhatvam means ashuddha chikitsa. Ashuddha chikitsa is the reason, primary reason for this Vyadhi Sangara. So this is also an important point. As the time is over, we will be stopping here. But definitely we will take a few more points into consideration here again. As we mentioned, certain concepts like Udarkam and all these things are not taken yet. But definitely we will cover. We have no rush. We will move very slowly, very comfortably and very happily. So as of now, I am stopping here. Thank you very much. Bhishajam sadhu vrittanam bhadram agamasharinam abhyasta karmanam bhadram bhadram bhadrabhilashinam. Thank you very much. So we will meet most probably on Wednesday or next Saturday. Next Wednesday I am traveling, so I'll try to not to skip the session on Wednesday, but in the worst case it will be informed in the group as well. Thank you very much. See you in the next session.